All right, so it looks like you're dealing with a rotator cuff tear and are looking for ways to get back in action. You'll be surprised how much you can do without surgery. We've got a video here from Dr. Dwayne Chioda. He's a physical therapist, and he has some clever techniques to help regain strength and mobility in your shoulder.
That's right. And these exercises are effective whether you're post-surgery or just trying to manage pain and improve function.
Okay, so let's dive into Dr. Chioda's recommendations. The first one is the pendulum swing. I have to admit, when I saw this, I thought, really, this is going to help?
I know it seems deceptively simple, right? But there's a good reason it's often the starting point for rotator cuff rehab. It's all about gently getting that synovial fluid moving in your shoulder joint. That fluid is like a lubrication for your shoulder, and when you've had an injury, it can become thick and sticky, leading to stiffness and pain.
So just swinging your arm, helps with that.
Exactly. That gentle motion gets the fluid circulating, again, reducing stiffness and easing pain. It's a great way to start mobilizing the shoulder without putting too much stress on it.
Okay, that makes sense. So for the pendulum swing, you're basically just leaning forward, supporting yourself with your good arm, and letting the injured arm hang loosely, right?
Yes, and then you just gently swing it in small circles back and forth or side to side. It's important to keep the movement small and controlled, especially at first. Dr. Chioda recommends doing this for about 30 seconds at a time, a few times a day.
So we're starting off nice and easy. Now, the next exercise is external rotation with a resistance band. This one sounds a bit more like a workout.
It is. External rotation is crucial because this is where most rotator cuff tears occur. These muscles help rotate your arm outward, and they're essential for stabilizing the shoulder joint. Strengthening them is key to preventing future injury.
So it's not just about getting back to normal. It's about building a stronger, more resilient shoulder.
Absolutely. Think of it like giving your shoulder its own personal trainer, but you're in control. You secure the resistance band at waist height, bend your elbow to 90 degrees, keep it close to your side, and then slowly rotate your arm outward against the resistance of the band.
And as you get stronger, you can increase the resistance by using a thicker band or moving further away from the anchor point.
That's right. It's all about gradual progression.
Now, the next exercise, the shoulder blade squeeze, sounds almost too simple. You sit or stand tall, relax your arms, and just squeeze your shoulder blades together. That's it.
It is simple, but deceptively effective. You see, people often focus on the big, powerful muscles of the shoulder, but they forget about the supporting cast. The muscles around your shoulder blades are crucial for posture and overall shoulder health. They help keep everything in alignment and create a stable base for your shoulder joint to move on.
So it's like strengthening the foundation of your house rather than just focusing on the fancy decorations.
Exactly. And strengthening these muscles can also improve your posture, which can have a positive ripple effect on your whole body.
Okay, I'm starting to see why Dr. Chioda includes this one. Last but not least, we have wall walks or finger crawls. This one sounds kind of fun.
It is a bit more dynamic, and you're right, it does tap into that inner child in all of us. Imagine standing facing a wall with your injured arm. You'll use your fingers to slowly crawl your hand up the wall, going as high as you comfortably can.
So it's a gentle way to improve flexibility and range of motion in the shoulder.
Exactly. It's like gently coaxing your shoulder back to its full potential, but it's also a great way to improve proprioception. Proprioception. It's basically your body's awareness of where it is in space. It's what allows you to move without having to constantly think about every little movement. And this exercise helps retrain those neural pathways so your brain and your shoulder are talking to each other effectively again.
So as we wrap up this deep dive into rotator cuff tear recovery, it seems like the key takeaways are those 4 exercises: pendulum swing, external rotation, shoulder blade squeeze, and wall walks, but also understanding the balance of active and passive recovery, being open to complementary therapies, and embracing the power of mindfulness.
Well said. And remember, this is just the beginning of your journey. Recovery takes time, and it's not always linear. There will be ups and downs. But with the right knowledge and support, you can regain strength and mobility and get back to doing the things you love.
It's been so insightful learning from Dr. Chioda's approach. He's clearly passionate about helping people understand their bodies and take an active role in their own healing.
He truly is, and his approach highlights the importance of that collaborative relationship between patient and healthcare provider. It's not about blindly following orders, but about understanding the why behind the recommendations and feeling empowered to make informed decisions about your own care. And I think that sense of empowerment is crucial, especially when dealing with an injury that can feel so limiting. It's about remembering that you have agency, that you can actively participate in your recovery, and that there are resources and support available to help you along the way.
Absolutely. It's about reclaiming that sense of control and confidence in your own body's ability to heal.
We hope this deep dive has given you the knowledge and inspiration to embark on your own rotator cuff recovery journey with a sense of hope and optimism.
And remember, recovery is not just about fixing the physical injury. It's about rediscovering the joy of movement and living a life that feels empowered and fulfilling.
Until next time, keep exploring, keep learning, and keep taking care of yourselves.
Subscribe for more pain relief tips. Valley Rehab, Physical Therapy and Return to Work Center.